Welcome back to Open Med School. Today I'll be discussing about the concept blood volume. So let us start. If a person suddenly loses 1 liter of blood, what will happen? So here comes the concept of blood volume. So what is blood volume? Blood volume is the total amount of blood present in the circulatory system. So I will repeat. Blood volume is the total amount of blood present in the circulatory system. And the circulatory system, as we know, consists of the heart, the great vessels, that is arteries, arterioles, capillaries, venules, veins, and the total amount present in this is the blood volume. So it is clear. And last session we have studied about the components of the blood. That is around 45% is RBC, 1% is the Buffy coat, and the remaining around 55% is the plasma. Now let us look what is normal blood volume for an adult male of around 70 ml per kilogram. So this is only an approximate value. 17 ml per kilogram is the blood volume. And for female it is 65 ml. For females it is little less. And the total blood, the fluid in the body is divided into various compartments that you will study later. So just remember the blood volume in a normal adult 70 ml per kilogram for males and 65 ml per kilogram for females. Of this, the majority or the large quantity of blood, that is around 39%, is in the veins. It is important to remember that. And the heart, only 7% of the blood is in the heart. And the small veins, it is 25. So now we can see that the large veins and the small veins constitute the largest quantity of blood in the body. And the systemic artery is only 20% of the blood. We have said about the pulmonary circulation, which contains around 9% of the blood. So approximately you can see that around 70% of the blood is in the venous system, 20% in the arteries, 7% in the heart, and around 9%. Yeah, approximately think around 10% in the pulmonary system. So this important concept, that is venous system, is the capacitance. It stores majority of the blood volume. Now we already said that females have got less blood volume, that is only 65 ml per kilogram for females. Why this difference? It is because females have got less muscle mass and they have got a higher fat percentage. Even though the weight may be less, their fat content is more. And that is why the blood volume is less in females. Now we'll just calculate. For a 70 kilogram man, approximately the quantity will be 70 into 70 per kilogram. So it is approximately 4,900 ml. Or you can just remember 5 liters is the approximate amount of blood volume. So remember this value, 5 liter is the blood volume in normal adults. We have already said that if you take the blood, the around 45% is RBC and the remaining is the plasma, that 55%. So this again, about 55% is plasma, 45% is RBCs, and 1% only WBCs and platelets together. The hematocrit is a term, clinical term that you should remember, that is indicative about the RBC volume. So here you can see this is the hematocrit. It is about the volume of RBC. It is the hematocrit. Again, the details we will study at a later time. Now we'll think about what are the factors that affect the blood volume. Some conditions will increase the blood volume. Some conditions will decrease the blood volume. So let us see the factors affecting blood volume. One common thing, pregnancy produces increase in the blood volume. So pregnancy is a condition where the blood volume increases. Suppose you are dehydrated, extreme sweating, diarrhea, vomiting, and again that the blood volume will decrease. If there is a bleeding, in the beginning we said about 1 liter of blood loss. What happens? There is hemorrhage will produce a decrease in the blood volume. What about heart failure? Heart failure, the blood volume increases. So about heart failure we will study later. In heart failure, the patient usually becomes edematous. Edema is more of fluid retention, so heart failure, the blood volume decreases. Suppose the patient develops burns. Large quantity of fluid is lost from the tissues. The burns when the skin is lost, fluid is also lost from the skin. In athletes, what happens? Athletes have got increased blood volume. So these are certain conditions. Just remember, dehydration, blood volume is less. So remember, blood volume is not constant. It changes with the body condition. As I have explained, somebody with diarrhea, vomiting, or there is a blood loss, naturally the blood volume will come down. Now we look at how the body is regulating the blood volume. The major thing is by the kidneys. We know that the kidneys is the responsible for excreting water. So kidneys are the main source. Then certain hormones you will study later. Of the very important one is the antidiuretic hormone, ADH. Then there are hormones like aldosterone, atrial natriuretic peptide, atrial natriuretic peptide. Natriuretic related to sodium. So it again is a hormone which produces sodium loss. So the regulation of blood volume is mainly by the kidneys. Then there are hormones are there. The nervous system also, because the taste when you are dehydration and feel thirsty. So there is different mechanisms by which the blood volume is maintained. Just remember kidneys, then certain hormones. What's the clinical importance? When the blood is low, the BP will come down and the organs are less perfused. That condition is called shock. Then patient with heart failure, there is an increase in the blood volume. In surgery and anesthesia, fluid loss. Following surgery, blood can be lost and can have loss of fluid. Volume will come down. So in shock, the blood volume, low blood volume, and such conditions are hypovolemic shock. Hypo means decrease. Volemic means volume. Volume is decreased. So when a patient develops, say, some person develops bleeding, blood volume is less, and they develop a decrease in the blood pressure and leads to decreased tissue perfusion. That leads to a shock, and that shock is called a hypovolemic shock. Hypo means low, decreased. So this can occur in trauma. So suppose somebody has got a bleeding, an accident, then the gastrointestinal bleeding, typical example is vomiting of blood. It is called a hematemesis. Emesis means vomiting. Hema means blood. So hematemesis means blood is being vomited. Or somebody develops a blood loss per rectum. For any condition that produces bleeding, it may be from various organs. In females, somebody with menorrhagia, that is bleeding per vaginum, that is menorrhagia, it is called menorrhagia. So these are all conditions you can get a blood loss. So what are the common conditions where you can get a decrease in the blood volume clinically? One is trauma due to bleeding, gastrointestinal bleeding, that is bleeding, vomiting of blood, or is called hematemesis, loss of blood per rectum, sometimes called melena, and in females, uterine bleeding, menorrhagia. These are conditions where you get a okay. Then increase in blood volume is seen in patients with heart failure. The heart fails to pump blood, the fluid accumulates in the body, so there is an increase in the volume. So remember, heart failure, there is an increase in the blood volume. The surgery is very important. Can be blood loss due to various reasons, various drugs can produce also redistribution of blood in various or venous system, and blood loss can occur during surgery. So surgical conditions, blood volume is very important. So this is important for emergency management, IC protocols, and of course blood banking. So what now we look into what are the effects of blood loss. 10% of blood loss, for example, we have already said 5 liters, around 10% means 500 ml blood loss, usually no symptoms. 20 to 30%, that is 1 liter approximately, so you'll get a decrease in the blood pressure. So it is important is that somebody has got a low blood pressure and has got a bleeding, that means more than 20% of blood volume is lost. More than 30%, that is around 1.5 liters, definitely the patient goes into shock. There is not only BP fall, but there is a effects due to decreased perfusion. So remember this point, 10%, 20%, 30%. 30% shock, 20% hypertension, 10% no symptoms usually. Then I already mentioned heart failure, there is excess blood volume, fluid overload, and it produces edema, breathlessness, etc. We will study later. Anesthesia and surgery, we already mentioned blood volume estimation helps in IV fluid management because patient anesthesia, under anesthesia, they are not able to swallow. Oral feeding is not there, so you may have to give IV fluid and transfusion decision if there is a blood loss is there. So remember, take a patient, a post-operative patient, the heart rate is around 120, and the patient has a decrease in the urine output. So that what does mean? It means the patient has got a low blood volume. When the blood volume decreases, usually the heart rate increases. That is why routinely we examine the pulse rate and blood pressure in patients coming to casualty. So the pulse is an indirect evidence. When the blood pressure comes down or blood volume comes down, even before the blood pressure comes down, the heart rate increases. So blood volume and blood pressure. Can BP be normal even when the blood volume is low? Think yes, because less than 10% blood loss, there is no changes are seen, except some increase in the pulse rate is called or heart rate is called tachycardia. It is called due to compensation, and compensation is by the adrenergic nerve system. Adrenergic system, about which we will study. So the normal BP is a dangerous, misleading factor. So that is to be remembered in triaging in casualty.